Her Story is a program that explores women, leadership, and healthcare.
Well, welcome to Her Leadership Story. I'm Joanne Conroy, the CEO and President of Dartmouth-Hitchcock and Dartmouth-Hitchcock Health. And it's my pleasure today to welcome Lisa David, who is President and CEO of Public Health Solutions. Public Health Solutions was formed in 1957, and its focus is actually improving the health of New York City citizens through several important programs. Number one, improving health generally. Number two, making sure that grants are applied appropriately to drive improved health equity in the city of New York. And finally, creating really a network of all other resources across the city of New York, so together they can improve the health equity of so many citizens that really fall through the cracks of our safety net. Lisa has been focused on being involved with women's health choices for her entire career. And it's something that we have so much to learn from. So Lisa, I'm thrilled to have you here. Let's start off with your early career. Just tell us how you actually started on the path that you're on right now.
Well, first of all, thank you, Joanne. I'm so honored and excited to be here and to share whatever wisdom I have with other women building their careers. So I'm the child of two clinicians working in academic medicine, and I always had an interest in healthcare. And in particular, women's health. And I think that stemmed from the fact that when I was in high school, one of my friends got pregnant, and our friends group scrambled to find the money, figure out how to find a clinic, and to take her there and help her post-procedure. And it kind of highlighted to me the enormous impact that having a child can have on your life when you're not ready and when you are ready, both positive and negative. And I remember feeling like this should be easier and every woman should have the ability to make that decision for themselves. It was 1973, so, Roe had just passed. There wasn't a big network. We actually found a Planned Parenthood clinic in the Yellow Pages, when you used to use Yellow Pages.
Well, we talked earlier, and I think I got my first birth control at a Planned Parenthood in inner city Newark, because that was where you could find it. Had my first pelvic exam at a Planned Parenthood there. So yeah, you had to be pretty resourceful to find the resources.
We don't make things easy for people in any dimension, and certainly being in the Northeast, it's a lot easier than if you're in the Midwest and there aren't resources, but it really had a strong impact on me. And I remember thinking, like going into college, that my ideal job would be to run a Planned Parenthood health center. My parents were activists. I spent my childhood out knocking doors and canvassing for Boston politicians. They organized the whole Harvard medical community to go down to DC to Vietnam War protests. And they never said so directly, but there was always the sense from them that you needed to fight injustice and you needed to have a positive impact on the world. I wanted to be in healthcare, and I did not want to be a physician living in an academic medical center world, because I saw the sort of political challenges every night at dinner, because they worked in the same place. But I did want to do healthcare, and in particular women's health. So I wound up at a consulting firm that was a healthcare boutique, APM. And the impact that I chose to have there, because it was dealing with much higher strategic issues, was to try and put in place a process to engage physicians to improve clinical quality. At the time that I was there, sort of physician decision-making were like sacred cows. You couldn't challenge them. We would work with the chairs and division chiefs, and we would pull data, which you only had out of the billing system at the time because they were all paper charts, and show the variability in how individual physicians treated what looked like the same patient. Just put that data in front of them and said, this is weird. What's the best answer? What are the right decisions? So we built a really big practice. And the wonderful thing about it was, unlike most consulting projects that have long implementation timeframes, if physicians agree to do something differently, they do it the next day. Like, there wasn't implementation. It was like, boom. And you would see resource utilization and bed utilization change overnight.
So what was it like for you as a woman? And why do you think you were successful? Did you have some edge about your personality or some characteristic that allowed you to navigate, which something that I expect would have a lot of like unwritten rules, a lot of male hierarchy. Healthcare was like that back then.
Oh my God, yes. They were all male physicians, and my consultants were all male physicians. So there was kind of an edge, sort of being a woman. I got a lot of attention, and I was an MBA. I was a suit. Sort of learning as a consultant is you have no authority whatsoever. You know, all you can do is recommend and pull together all these fancy decks to support your recommendations. So I sort of cut my teeth on being an influencer, not a decision maker. And so if you can just step back when the arrows start to fly and say, look, this is the reason we need to look at this. I mean, there can't be 37 ways to treat a patient. That's, you know, some of them have to be better than another. And then you have information and data to share, you engage people. And so I think being raised in consulting where the best you can do is influence and honing that skill has really shaped my own leadership style. I am not a hierarchical leader. I am an influence leader. But what I bring to it is I'm really good at 30,000 feet. I'm a systemic thinker. And so I can see, like, this is where we need to get to, and here's the intermediate steps, and make the case. And the piece about making that work, I think, is you have to understand all the stakeholders and their interests, because they basically just follow the incentives that they're given, and they're different. And so if you can relate to the way they think about things and come up with kind of solutions that work within that, you can make big changes.
Do you think your activist dinner table at home prepared you a little bit for this as well? Because I've never thought of you as reticent to speak out on something that you thought you could contribute to.
Yes. And I will particularly say that my mother was the most argumentative person and well-read person that I've ever met. So, and she loved arguments. So she would take either side. It didn't even have to be what she really felt, but she always had, you know, read everything. And which is why my sense of academic medical center politics, I think, was so astonishing to me. But it's because she didn't accept anything. I'm sure that was inculcated into my essence of, you should speak up, you need to be prepared to speak up, you need to have the case, and that you can make change.
I think women sometimes are a little bit conflict averse, and you have to be very comfortable with conflict and not take it personally and just be able to navigate that. Sounds like you had some great training around your dinner table. How about other mentors?
I've had mentors in almost every job I've been in. And sometimes it's like, when I was consulting, it was the founder of the firm. It might be just a senior manager or somewhere else that you make that connection with, but is wise and can give you advice. So earlier on in my career, it was very much people within the organization that I was in that were more senior, that sort of put their eyes on me and said, I'm going to help her. When I was a little bit further along, I actually had 2 formal coaches. I think every organization has its politics and its culture that have to be navigated. I think I've been at some that are pretty challenging, but it was different to have a coach because they're really helping you drive your agenda and priorities as opposed to how you go about doing the work you're doing. And so I found both incredibly helpful. And because I had been given that kind of support, I mentor a lot of people, and people that I've worked with long ago who still come to me and say, help me think through this. Yeah, it's amazingly helpful. And I think it works best if you find each other as opposed to you're assigned to somebody.
I agree. The coaches that have been most helpful to me, our lives just collided. So let's talk a little bit about your career journey, because you ended up in academic medicine.
I did. My parents were astonished.
You actually had a wonderful opportunity at Columbia in the practice part.
Right. Well, before that, I was in consulting for 17 years, 13 years at APM. And actually, somebody a year ahead of me in business school said, I'm recruiting you. We did a consulting project together. He says, you're going to go where I go. And in fact, I did. After 13 years, I actually left and went to a smaller, more boutique women's health consulting firm where I was managing director. When I was there, I did a project with Columbia. There was a new chair, a woman chair that we had worked with when she was in New England Medical Center, and she came in as chair, and we offered to do a turnaround plan for her because the department was financially a mess and in several other ways a mess. And so I was there 4 months doing a turnaround plan, and at the end said, I've been consulting 17 years. I haven't done anything that I can put my name to. And I said, look, you know, New York doesn't have much in the way of women's health. There's nothing stellar. This is Columbia, it's New York City. You are an amazing leader. And if you wanted, I would be willing to stay and be the department administrator. And she was absolutely delighted. And in fact, I was there 6 years. The first 3 were very wonderful because we were cleaning up our house. And we had all the authority to do what we wanted to do. And we started to build some of the subspecialty programs. And we set up a program for women with very challenging pregnancies that was done in total collaboration with all the pediatric subspecialties. And what I learned from that is you have to trust women. You give them the information to make their decisions, and honestly, you can't predict what they're going to do. I had families that had a baby with anencephaly, no brain whatsoever, was definitely not going to live for long, but they were going to be delivered and they were going to be very resource intensive and very challenging for families, and they decided to keep the baby. And on the other hand, I had a woman who tried 3 times with infertility and wound up pregnant with twins, and sort of late in the 3rd month said, this is a mistake, I want to terminate. So you have to respect women, and you have to give them the information to support their decisions. And then the next 3 years, it was much more a battle within the hospital and medical school organizations. And I was successful in negotiating a lot of support from the hospital because this prenatal pediatrics program was putting a lot of babies into the NICU and a lot of pediatric surgeries. And so they gave us support because we had a huge amount of Medicaid patients. And then a new dean came in and didn't think that we needed to have a strong OBGYN department, and we were the fastest growing clinical department. And he couldn't go after my chair, who was an extraordinary woman, and I've been lucky to work for some extraordinary women. She was a triple threat in every sense of the word, very strong clinician, very strong educator, and very strong researcher. So they went after me. And they really he wanted to dismantle everything that I built, and he wanted the support that I was getting from the hospital to go into other clinical departments, which I fought. And it was extremely emotionally challenging. I was a mess. And I have to say, I give all credit to the woman who ran Baby's Hospital at Columbia, came to me after a year of this torture and said, you can't take this personally, and you are not going to win. It's time for you to move on. Best advice I ever got. And after I left, he sort of left them alone. So from there, I went to Planned Parenthood I had done a lot of pro bono work over the course of the years because the consulting firm I started, when we started, we were in the same building as the National Planned Parenthood Federation of America. So I did pro bono work for 3 different presidents. And when Cecile Richards came in, she was told by somebody from Columbia that she should talk to me. And I had turned them down a couple of times about taking a job there, but at this point I reached out to them. And so I took over their sort of support to affiliate health services. I took over healthcare. And Cecile was yet another extraordinary woman, mentor, and just the embodiment of leadership. She's an amazing speaker, an amazing visionary. And to this day, when I hit a challenging situation, I say, Lisa, channel your Cecile.
What a gift to really work in that organization at that time. You must have felt like your career had come full circle.
Absolutely. And I wanted to run a health center, and I'm running national healthcare. They gave me education, medical services, global work. And then when the COO left, they gave me those corporate functions of HR, finance, and legal. It was probably way too much for one job, and that was the kind of organization. There was probably more stress because they were totally under attack all the time. We came in just as the Republicans had taken over the House. Their first 10 bills to hit the floor were to defund Planned Parenthood. So it was very challenging situations, but it was a different politics. It was external politics, not internal politics. And I felt every day like what I'm doing is critical, and it's life and death for women. So it was an extraordinary 6 years. And from there, I wound up being asked, one of the big donors for Planned Parenthood had set up a nonprofit pharmaceutical to create a hormonal IUD that would be affordable for low-income women. So many of the Planned Parenthood and other reproductive health clinics couldn't carry Mirena because it was too expensive. And so it was part of the funding contract that this hormonal IUD would be available at $50 to 340B clinics. And I happened to arrive there. I was on the board for a couple of years. The founder stepped down, and I arrived there the year that we got FDA approval and launched the product. And I can tell you what I didn't know about pharmaceutical companies was everything. It was interesting. I hired a wonderful OBGYN to be the president and just went back on the board. But while I was out there, and this was in San Francisco, I got a call from somebody from Planned Parenthood, somebody from the funder, and somebody from Columbia saying, there's this organization, Public Health Solutions, and the CEO is retiring, and we think you would be great for them, and this would be great for you. And they recommended me to the search firm, and I wound up with that CEO job. And I didn't know anything about public health. I was an acute care person, and the public health system is much more complicated and tortured than the acute care system. But we were really a partner of the New York City Department of Health, and almost all the work that we did, they had asked us to do. Recently, we've been trying to knit that sort of contracting ability and direct service experience to create a more formalized public health infrastructure at the community level, putting together a variety of community-based organizations, inserting technology that allows information to flow back and forth, so we actually know if we make a referral, do they actually get services, and we get back how much they got. So that, and then having to integrate that back into healthcare. So this is, in this organization, sort of how I think we can change the world, is this is desperately needed and will have a big impact on community health and individual health.
So I think that public health and public health equity is actually coming into its own now. And you are perfectly poised from your experience from data to really having a kind of systemic view, because you can't get too lost in the weeds because you'll never find your way out. There are a few signature questions we like to ask. I think I know the answer to some of these. Do you consider yourself to be an accidental or an intentional leader?
It's funny because I've moved from place to place with a network of help. So in some respects, I wind up being CEO accidentally, though I will say I never aspired to be a CEO until I went through the legacy program with that you set up. I never sort of stepped back. My whole lens was impact, not power. I can't say I'm an intentional leader, but I have felt like you don't need to be a CEO to be a leader. I felt like I've been a leader in every single one of the roles I've had. So in that respect, it is intentional. That if you focus on where you are and think about the bold ideas that you can put in place and make them happen, you're going to have impact and you're going to grow.
Also, what piece of advice would you give your younger self?
My advice is pick a job that you really want to do. And I know that's hard, and it's even harder for young people today than it was when I came out. Like, I've never been driven by money for a job. My first job at Harvard School of Public Health paid $10,000 a year. And I remember hearing somebody on the sidewalk who must have been a Harvard Business School student say, I got my $40,000, thinking, I'll never make $40,000. I think life is just so much better if you're committed to and enjoy what you're doing. So I would prioritize that over money. What I do every year at the end of the year as I start a new year is I say, what do I want to learn next year? And what do I want to get accomplished in this organization? And if that's a compelling thing, I agree to stay. I'm committed to staying. But what I've learned over my job 10 years is it's equally as important to decide when to leave as when to go to a job. If you hear yourself saying, oh, we tried that, or I know how everybody's going to respond to this recommendation, and so I'm not going to put it forward, you've become part of the problem, not part of the solution. So I stayed in this consulting firm 5 years too long, for sure, and didn't have the kind of impact that I'd had in the first 8. And I had to be guided out of Columbia from somebody. I was so intent on fighting that I was sort of destroying my emotional health. And all I was doing was defending. I wasn't moving the place forward. So if you want to make change, it requires new ideas and energy. And at some point, you sort of bypass that. And it's important to recognize that and say, okay, time for something new.
That's great advice.
And we don't think about it, and we think of that as kind of failure and challenging, but if you want to keep having impact, you got to move on.
And finally, if you wrote your story, what would you title it?
Bold ideas, how to change the world. I'm not so egotistical as to think I personally have changed the world, but in each role that I have had ideas that we've been able to sort of nestle people committed to them and get them done that has had significant impact on the quality of care.
Well, thank you, Lisa. I'm just so impressed that the journey to really support women's health has been kind of the touchstone of all of your career choices. And you have made an impact in every single one of those. And we still have a lot of work to do.
We have more work to do than we did 10 years ago.
Yeah, but I feel confident with you in our corner. Thank you so much.